Doing a 7-point skin fold measurement, take all measurements on the right side of the client's body. With the client standing upright, the client's skin should be dry and lotion-free. Do not take skin fold measurements immediately after exercise. Identify and mark all sites before measuring. Firmly grasp the skin fold between the thumb and the index finger of your left hand, 1 centimeter above the site to be measured. To grasp the skin fold, place the thumb and the index finger about 3 centimeters apart on the line in the perpendicular to the long axis of the skin fold. Pull the skin up and away from the body. Keep the fold elevated while the measurement is being taken. Keep pinching the fold while your left hand throughout the entire measurement. Hold the caliper in the right hand with the dial facing up. Place the jaws of the caliper perpendicular to the fold 1 centimeter below the fingers and halfway between the crest and the base of the fold, and release all pressure of the scissors while keeping the caliper perpendicular to the skin. Record the skin fold measurement to the nearest 0.5 millimeters 1 to 2 seconds after releasing the scissors grip. Take the skin fold measure in rotation of order to allow time for the skin to regain its normal elasticity or thickness. Take a minimum of 2 measurements at each site. If duplicate measurements are not within 1 or 2 millimeters or 10%, retest this site. Calculate the average of the skin fold site using the client's measurements and validated skin fold equation. Percentage body fat can be determined. Equations such as Bohr's equations and series equation will be explained later. So the first measurement we'll be taking is a chest. It's going to be chest diagonal fold 1/2 the distance between the anterior axillary line and the nipple for men, or 1/3 the distance between the axillary line and the nipple for women. Next, moving on to the mid-axillary vertical fold on the mid-axillary line at the level of the xyloid process of the sternum. Moving on to the suprailium, this is going to be a diagonal fold in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. Moving on to the next one, it's going to be the abdominal vertical fold, 2 centimeters to the right side of the belly button. Moving on to the thigh, it's going to be a vertical fold on the anterior midline, midway between the proximal border of the patella and the inguinal crease. And you want to make sure the patient is not flexing during this one. And moving on to our last two, we're going to start with the tricep. It's going to be a vertical fold on the posterior midline of the upper arm, halfway between the acromion and the olecranon process, with the arm held freely to the side of the body. Make sure the patient does not tense up to get an accurate reading. And lastly, moving to the subscapularis. This is going to be a diagonal fold at a 45-degree angle, 1 to 2 centimeters below the inferior angle of the scapula. And this concludes the 7-point process.